Art therapy is an area that has always interested me, even more so over the past 6 weeks as I have begun to volunteer during my plan period to teach art to the students in the autism unit at my school. I am working with 5 high school students who are developing skills that they can use when they graduate high school, as well as to find areas of interest which will allow them to lead a higher quality of life. The jobs which they will be able to do may not offer the life satisfaction that many people are able to find in their careers. So I, along with their teacher, are helping them to find areas in which they enjoy. This history of art therapy focuses on the precursory and continuing trends that have shaped the theory and practice and the literature that reflects this development. Art making is an innate human tendency, so much so it has been argued that, like speech and tool making, this activity could be used to define our species. Hospitals have long seen the importance of the field of art therapy. Medical concepts such as diagnosis, disease, and treatment have had a strong influence on the development of most schools of thought within Western psychotherapy, including art therapy. While psychiatry has always been the medical specialty most closely allied with the field, art therapists have worked with patients being treated for AIDS, asthma, burns, cancer, chemical dependency, trauma, tuberculosis, and many other medical and rehabilitation needs. Our understanding of the interplay between biochemistry, mental status, and creativity continues to evolve, and a new medical specialty, arts medicine, has emerged. All of this suggests that art therapy will continue to have a role in exploring the connections between body and mind. The idea of moral treatment came about for the insane in asylums in the late 1700s. Moral treatment was based on a utilitarian philosophy that moral values were created individually through the process of people making judgments about the actions of others. This paved the way for the use of the arts in therapy and treatment for the insane. At the end of the 18th century, madness was viewed differently. Being mad was not necessarily seen as unreasonable. They began to treat insane patients morally and used the arts to tap into emotions in a controlled manner to find out a patient's story. Kindness was used as a tool for therapy instead of cruelty and punishment. A dominant 19th century idea that used both the arts and sciences to formulate its reasonings. The idea of degeneration was biblical in origin and thought people to be considered degenerates if they were savages or mentally ill because they degenerated from Eden's perfection as a result of some sinful behavior. Degenerates were considered to be children and peasants, women, laborers, and even the insane. This led to many being condemned to asylums because of the thought of so many to be degenerates. During the 19th century, psychiatrists began to theorize insanity not as a psychological or psychosomatic disorder, but as an irreversible brain condition as a product of degeneration. They also believed it to be hereditary, and it will become worse and worse every generation in a family line. The beginning of psychoanalytical and psychotherapy began in this time after World War I, when there was a heightened interest in psychogenesis of the shell shock from World War I. This was a time when many became mentally ill or physically disturbed from the effects of war. For much of human history, mental illness was regarded with fear and misunderstanding as a manifestation of either divine or demonic forces. Freud and Christ, to name a few, contributed to this rehumanization by theorizing that rather than being random nonsense, the productions of fantasy revealed significant information about the unique inner world of their maker. Building on these theories, many writers began to examine how a specific sort of creative product, like art, could be understood as an illustration of mental health. Soon enough, Margaret Naumburg helped to bring about the term art therapy, and it began to be used to describe a form of psychotherapy that placed art practices and interventions alongside talk as a central method of treatment. Thought to be the earliest of pioneers for art therapy in the U.S., Naumburg was primarily an educator, second, a psychotherapist, and third, an art therapist. She believed art had an evocative power to unlock repressed material. She believed the process of art therapy is based on the recognition that a person's most fundamental thoughts and feelings are derived from the unconsciousness reached during expression in images rather than words. Art therapy during the 1970s and 80s grew into a separate profession. Art therapists built primary partnerships with medicine and psychiatry, resulting in jobs being created at mental health centers, medical centers, day treatment programs, and substance abuse programs. Art therapy was heavily influenced by the educational field and Froebel's ideas of art and its therapeutic qualities for students. In the 1970s, there began to be a division in the theories of practicing art therapists. Some practiced art as therapy, and some practiced art psychotherapy. The art as therapy art therapists used the healing power of making art and favored process over product. The art psychotherapists used art as a healing tool within the framework of verbal psychotherapy. Over the past decade, art therapy has become an integral part of expanding social services, and a new focus has been placed on the healing aspects of expressive arts. Art therapists have now been working collaboratively with health professions, cancer programs, prisons, trauma relief teams, and personal growth classes. Art therapists now are also employed in school systems to address the needs of children with physical and learning disabilities. After 9/11, art therapists were assigned to work with victims and family members of the World Trade Center collapse and with police, fire, and medical units that were on the scene. This served as a way for patients to grieve and show the terrible horrors they witnessed that day. Every art therapist knows there is much to be learned from the process of making an artwork, as well as from standing back and viewing the finished product. Art therapy is a living work in process. There's pleasure in admiring the work that has already been done and excitement in what is evolving.